So welcome everyone. Thank you so much for being with us tonight. As we're slowly getting back into our normal programming, it's really nice to see a room full of people. So I am excited to have Jack Miner joining us tonight. Welcome. Hi. Jack spent the first part of his career in corporate human resources and consulting, but now his focus is on helping people navigate Medicare. He's currently the president of the Clearview Group Advisors, an independent agency that for the past 9 years has used a personalized touch and a goal-oriented approach to help people sign up for the various health insurance products with a specific focus on Medicare. So tonight he will be presenting Medicare, putting the pieces together. So I'm going to turn it on over to Jack.
Katie.
Thank you.
So, and what, can you take your copy so that you can get some? Katie, could you make a copy of that? We don't have
gotta be flexible. Something's always not going to go as planned, right? So hopefully everyone is here to learn about Medicare tonight. Yes. So we've got a shortest presentation, and then we'll be able to answer some of your questions and hopefully set you all on the right path to manage your health insurance needs over the coming months. So, then the clicker doesn't work. We'll just use this. Interesting. Bear with me, folks. Right when Katie leaves the room. Okay. Nothing's happening.
Doing escape.
There we go. Okay. So first, I want to talk about our agency, the Clearview Group Advisors, a little bit. We do have 4 active agents, all based in Western Pennsylvania. All are licensed to sell health insurance products. You can see myself. Gretchen is also here tonight helping out, along with Patty, who's actually the founder. I think if there's a couple of things I want you to know about our agency is that we are independent. And what does that mean? That means that we contract with all the players, the national health insurance companies, the local players. So we're really agnostic in terms of which carrier that we might help you narrow down your choices to. We want to put you in the right plan, regardless of which logo is on the card. We do help people with Medicare products. We also help people who are under 65 that might not qualify for Medicare, and then auxiliary stuff like dental and so forth. So for most of the whole health spectrum for individuals. Our specialty certainly is Medicare, and the majority of our clients engage us to get help with Medicare. Our approach when we work with clients is it's individualized. So it's all about what your needs are, both financially and from a healthcare perspective, and how you want to accomplish that. We help sort of simplify things, narrow down your choices, help you make an informed decision, and then we assist with getting signed up, and then thereafter answering your questions, and then making changes down the road as necessary. That's our approach. Pretty simple. Tonight's event is an education session, so we're not going to talk about specific products. We can address that on a one-on-one basis later on, but the presentation is education. So we're going to follow a pretty typical path. I think we're going to talk about signing up for Medicare, when you become eligible and how you do that. Then we'll cover some necessary terminology around cost sharing and how Medicare cost sharing works, the different elements of it. We'll talk about parts A and B, what they cover and how they work. Then we'll talk about additional coverage. You've probably heard about Medicare Advantage plans, Part D prescription plans, Medicare supplements. I'll break those down and help you get a good feel for the puts and the takes around each one, and what might be, how to make a decision about which path works best for you. And then we'll talk about the all-important step of actually, once you have your choices narrowed down, making a selection and some of the considerations that you'll want to think through. And did they tell you there would be a quiz? There will be a quiz, and we'll answer some of your questions. So on your, well, I don't have any more, but you should all have a handout with, first page is a map. Medicare choices, step 1, option 2. That is your map. We'll be using that as sort of our guide throughout the presentation tonight. And you don't have these on your chair, but you might have got this in the mail recently. The Medicare and You 2022 book. If not, you might, that might be coming, and we can get that for you. Tons of good information that's put out each year by the Centers for Medicare and Medicaid. And the other one is a similar publication from the same organization that is talking to Medigap, that is also full of useful information. Those are really the official sources from CMS that cover the topics. So useful information as we dive into this. Page 2 and 3 of your handout is the quiz. So this is just a way to, make sure that we're keeping your attention and that you're walking away with some of the most important points. We'll go through and have a little competition at the end to see who can fill in the blanks. One little tip: if you see that icon in the top right corner there on the page, that may mean that it's going to be on the quiz. So just keep that in mind. Informally. Okay, so thankfully we have a sizable group tonight. So I think it's probably best to hold your questions for the end. You can ask. We'll do group questions at the end, and then if you want to hang out later, once people start to head out and talk one-on-one, that's perfectly fine too. I'll stick around until everyone's gone. Okay, let's dive into it. First section. If we're going to understand the pieces of Medicare, a good place to start is how and when should I sign up? So the first step of your Medicare journey is deciding, is signing up for Parts A and B Original Medicare. That would be the blue and the orange puzzle pieces, or if you're looking at your map, that top square with A and B Original Medicare. So when does one become eligible? There are two ways that people can become eligible for Medicare. Either you turn 65 years old, or if you're under 65, you can qualify on the basis of a disability. You're eligible for the same benefits with either scenario. Once you become eligible and sign up, you'll get that pretty red, white, and blue card through the mail. How do you sign up is the next logical point of discussion. So if you are 65, for example, and you're already taking Social Security, you will automatically get signed up for Medicare. Some of you probably are right in that window right now where you've gotten your card and you're about to turn 65. So you will automatically get that card in the mail, and your Part A and your Part B will be effective on the first day of your birthday month. So if your birthday is July 15th, you will be effective on July 1st, 2022. If you are not yet taking Social Security, you will not automatically be signed up. So in that case, you're going to have to take action. If you are not taking Social Security and you're about to turn 65 and you decided that it's time for you to go on Medicare, you will have to take action. This is where we really start to get involved, is when should I sign up? How do I sign up? Once we've engaged with a client. So to do that, you have a few options. All of the Medicare signups for A and B are handled by Social Security. You can go online and create a My Social Security account. That's probably the path of least resistance in most cases. You can also call or visit your local Social Security office. Okay, so once you have, Medicare will confirm, they'll send you a letter to confirm that you've signed up. So that's key, because signing up for Part A and B, as we'll see, is the ticket to the ball game to get additional coverage to make sure that you have what you need. Okay. So we've talked about who can sign up and how they can sign up, or when they can sign up. What does that window look like? So using the 65-year-old example, that sign up window is called your initial enrollment period, and it actually begins 3 months before your birthday month and ends 3 months after your birthday month. So that is a 7-month window to get signed up for Parts A and B. And for most people, that's when they will also select their additional coverage: Advantage plans, prescription drug plans, supplements, etc. Oh, look, I see a little quiz icon on the upper right. Good to know. Okay, so some of you may be thinking to yourself, I'm 65, I'm 66, I'm 67. I'm still working. I've got a dependent that's on my employer plan. I can't go on Medicare. It's not going to work for me right now. So you may choose to defer Medicare until the time when either you retire or circumstances present themselves when you choose to go on Medicare. So if you're not ready to go on Medicare and you work for or you are covered by a large group insurer plan, and for our purposes, large would be 20 or more employees, you can defer. So what we tell people in those circumstances is, I'm going to use the turning 65 example again. What you should do if you work for a larger employer, or you're a dependent of someone who's on a larger employer plan, you should sign up for Part A when you turn 65. It's going to save you a little bit of paperwork later. You would then defer. You have the choice to defer Part B, and I'll tell you why that's important in a minute. You're going to maintain your employer coverage, and then when the time comes, you will be eligible for what's called a special enrollment period, and at that point you can sign up for Medicare Part B. Special enrollment period begins when you're after 65 and you leave the group plan. It's an 8-month window from when your plan ends, and for most people, the goal is to not have a gap between their group coverage and when they go on Medicare. So we time that very carefully to make sure that you don't incur any extra expense and you have no gap in coverage. Always good to be communicating with your HR contact during this time when you're getting ready to retire or leave the plan for whatever reason, to make sure that that things work out and you don't have a gap. Okay, so there you go, Medicare. One exception for signing up for Part A is if you are on a health savings plan, there could be some tax implications if you do sign up for Part A early. So that's something to consider. That we do encounter that from time to time. So I think if you are on an HSA with your group plan, it's good to talk to one of us and talk to your HR folks to make sure that that's managed so you don't have any tax implications, because we want to make sure that you don't incur any unneeded costs during the process. Okay, so timing is really important. If you do not enroll when you're first eligible, either leaving the group plan or turning 65, you could be hit with a late enrollment penalty. If you have a late enrollment penalty for Medicare Part B, that's going to be a 10% premium increase for every year that you have not signed up that you are eligible, and that does not go away. So you want to avoid that by signing up when you're first eligible. Part D is a little different. It's 1% per month of the average premium. So the meat of it is you don't want these late enrollment penalties because they don't go away, and you're going to incur extra costs for more costs the longer you're not enrolled. Okay. So if you do miss your enrollment period, you may be hit with the extra cost, but you're not completely out of luck. You can still enroll using the general enrollment period, and that would be each year from January 1st through March 31st. The coverage would not start until July 1st. So, you know, you're at risk of having a gap, I guess, if you look at it that way. Timing's important. Okay.
So say that again? Yeah.
So you want to be sure you sign up when you're first eligible and have a plan laid out in advance to make sure that you don't have gaps, but also you don't want to get hit with those late enrollment penalties. If you do miss your special election period, you've got to wait until Jan 1 of the following year, and then your coverage won't be effective until July 1st. I'm happy to clarify that that's a good stopping point. For, thank you for that. Okay, so cost sharing. Every insurance product that I know of has some kind of cost sharing, whether we're talking about auto or homeowners or life insurance. And that's simply when the insurer pays part of the cost for the service and the beneficiary pays part of the cost for the service. With Medicare, we have different elements of cost sharing. So a premium, you know, that's the fee that you pay on a regular basis to remain with the insurance product. Some Medicare products will have a premium, others will not. Sometimes you'll see deductibles too. A deductible is where you pay a certain dollar amount before the insurance kicks in. We're probably all familiar with that with our auto policies. Again, some Medicare products will have a deductible, others will not. And then we've got copays and coinsurance. So copay is a flat dollar amount, maybe $35 to see a specialist, to do a specialist office visit, go see your cardiologist, for example. Coinsurance, likewise, is a percentage of the service instead of a flat dollar amount. You know, using Part B as an example, an outpatient surgery, you'd be responsible for 20% of that cost if you only had Part B, and that'd be a perfect example of coinsurance. So the key when you're comparing your options is to make a selection where the cost sharing is favorable to the objectives that you're trying to accomplish. And that's, we spend a lot of time helping people compare options and determining what's best for them in terms of cost sharing. So one other topic here, when we talk about the annual maximum out of pocket, that includes the deductible plus the copay plus the coinsurance. If we're talking about Medicare Advantage plans, there is an annual maximum out of pocket limit of $7,550 per year. There are plenty of plans in Western Pennsylvania that have a much lower max out of pocket. That's good. But that's a very important topic when it comes to thinking about costs.
That's only for Advantage plans, or that's for A and B together too?
There is no maximum out-of-pocket limit for A and B. So I'll dive into this. You know, I'm laying the framework for what we'll talk about later. So this is probably the most dry part of the presentation, just going through the terminology. But that the limit for Advantage plans in 2022 is 7.5. Okay, now this is a little bit more juicy. Let's talk about features of Part A and B. Again, let's reset and look at the map. We're talking about the first step in your Medicare journey, and that's signing up for Parts A and B. We've already talked about how to do that, but let's talk about what A and B cover. So Part A Medicare Part A is commonly called hospital insurance. You'll hear that reference a lot. And that's going to cover your inpatient hospital visits. It's going to cover your skilled nursing, your inpatient rehab, hospice, and home health care. So that is Part A. Part B, on the other hand, will cover it's commonly called medical insurance. And you can think about this as doctor's office, clinics, preventive services, diagnostic tests, surgeries, outpatient surgeries, therapies, and a whole list of other things. To simplify, anything with a hospital bed would be covered under Part A. Outpatient services are covered under Part B. But sometimes it's better to think about what's not covered. What is not covered by Part A and Part B are things like single rooms at the hospital or luxury amenities in the hospital. That is not covered. Your first 3 pints of blood are not covered. Dental, vision, hearing are not covered, and then notably prescriptions are not covered. So Medicare will cover your pretty much comprehensive health services, but with the exception of prescriptions and dental and visions, notably. So A and B, remember we're still talking about original Medicare, government Medicare. What does it cost? So with Part A, there's no premium, $0 premium. And that's why we said, a couple slides ago, it makes sense. It's going to save you paperwork later to sign up for Part A, even if you're not ready to go on full-blown Medicare, because there is no premium. And that's part of the reason. Part B does have a premium, $170.10 per person per month in 2022. So that's why it's, that's real money. That's why it makes sense to come up with a plan to make sure that you don't want to have a gap in your health insurance, but you also don't want to pay an extra few months of Part B if you don't have to. You don't want to start that until you're absolutely ready. So that's part of the consultation that we provide is coming up with that roadmap to make sure that you don't pay Part B early. So if you are a high earner, your Part B premium will actually increase. I do have a chart in the back of your handout that explains this. The threshold to go beyond the base premium, if you're filing as a single person, is $91K, and as with a joint tax filing, that is $182K.
So I was given a year's pay to walk away from my job, so my income is yearly double.
Mm-hmm.
And I read you can file to try to get it reduced.
Yes.
So does that take a long time, or is that a big hassle?
The appeals process for that is surprisingly easy. If you have a life event and you project your income as being under that threshold, they're going to work with you. Now, if you've projected wrong and then you file your taxes, then you'll owe more. But the appeals process is rather simple. People are always surprised by how clean it is. But that's part of the consultation that we do, is if you're going to fall into that boat and there's a reason to think that, if you think about it, many people who are going on Medicare are retiring. So their income is naturally going to be falling in most cases. So the appeals process is really important in those cases. We do a lot of that.
That's sort of a related question. So let's say your income fluctuates pretty widely once you're retired. Okay, so 1 year you're in one group and the next year in a different group. It just resets every year. You don't pay the same premium forever and ever based on that.
No, it's always going to be based on your last tax filing year, but in practice probably 2 years behind.
That's fine. I just wondered when it fluctuates a lot.
If you do have questions, write them down and we'll hit them all at the end. No, it's okay. It's a small enough group. It's not exactly a packed house, so we can be flexible, but I don't want to go down too much of a rabbit hole because I want to be sensitive to everyone's time. Okay, so that is, that's what the premium picture looks like for Part A and B. Now, if you only have Part A and B, where can you get care? Well, the answer is anywhere in the United States. Any provider who accepts Medicare, which last time I checked is pretty much all of them except for pediatricians. Okay, so like I said, Part A and Part B are your ticket to the game. And if you have Part A and Part B, then you've got health insurance, but is that enough? So most people will engage with people like me to talk through their options and buy additional coverage. And the reason for that is because with original Medicare, there is no maximum out-of-pocket limit. The out-of-pocket costs, which I'm going to show you in 1 or 2 clicks here, they're not capped. So for Part A, if you were admitted to the hospital, you're going to be responsible for a $1,556 deductible up to 60 days. And that's for, all those Part A covered services. Could be an inpatient surgery, all the nursing and food and tests and so forth that might accompany that stay, inpatient rehab, etc. If you have an extremely long hospital stay, they're going to start tacking on these per day copays of $389. And then if it's greater than 90 days, it's going to be $778 per day. So granted, that's a very long hospital stay, but the important thing is there's no limit to that. So for most of us, that would become unmanageable pretty quickly. For Part B, and this is actually kind of deceptive. There is an out-of-pocket cost for Part B in the form of a deductible that's $233 annually, which, really if you have almost any service, you're going to hit that. After that, you're going to be responsible for a 20% co-insurance per service. And I think that's probably the kicker when it comes to the out-of-pocket costs with original Medicare. If you've got monthly procedures, services, if you've got a year where you've got a couple of procedures that have to happen, that 20% can add up very quickly, and most of us would not be able to handle that without additional assistance. The other reason why people buy additional coverage is because Medicare, as of 2022, still does not cover prescription drugs. So, and then just to reinforce the point, with original Medicare, there is no maximum out-of-pocket. Additional coverage will help you manage. Okay, you should know that there is help out there for people that can't afford the Medicare expenses. Just to call out a couple here, there's the Medicare Savings Program, which is through the PA Department of Public Welfare. For drugs, there's a number of programs, including PACE, PACENet, and Extra Help. There is much more than I have listed here. If you go to the Medicare.gov page, there's a lot listed, and we've helped clients work through these programs at times. Just an FYI. Okay, so we've covered Parts A and B, the costs, what it covers, what it doesn't. So now it's time to talk about the solutions to some of those shortcomings. So we're going to start with prescription drugs because Part D prescription drugs applies to both options, whether you're going to go with a Medicare Supplement side or an option 2 with a Medicare Advantage plan. Both will more than likely include a Part D. So how does a Part D prescription drug plan work? So Medicare does not pay for prescription drugs. They do regulate the private companies that offer Medicare prescription drug plans. So that's a distinction. And they're very regulated. just not subsidized by Medicare. Prescription drug plans work in pharmacy networks. Both you can walk into the pharmacy or you can do your mail order, which a lot of people find that convenient. They do operate in pharmacy networks. So you'll see the terms preferred pharmacy or in-network pharmacy. Obviously, you're going to get the best price at a preferred in-network pharmacy. So that's one of the criteria that we plug into the conversation is, where do you currently get your drugs, and let's make sure that we can give you some level of convenience, but also balance that with getting the optimal price. And then these prescription drug plans, they're based on a formulary, and a formulary is a list of drugs. They are required to cover every drug category and carry 2 different types. Different plans will have different lists of drugs, and each plan will determine the retail price of the drug and the tier of the drug. And those could vary significantly between Highmark and Aetna, or United and UPMC. So it's not incredibly intuitive, and that's why it's helpful to be very thoughtful about this and model your prescriptions in a way that we can predict what those costs are going to be, and make sure that you're getting the right price for what you need. So let me talk more about the tiers. The retail price is set by the carrier in coordination with CMS, as is the tier. Tier 1 are usually very inexpensive generic drugs. Tier 2 are more expensive generic drugs, and so on, all the way up to specialty Tier 5, which can be very pricey. Tier 1 drugs often are going to be a $0 copay, and so on up the chain. So I think we've got a couple slides here that outline how the buckets work and when the copays come into play. So you will pay a premium for if you have a standalone prescription drug plan, there will be a separate premium associated with that. If your drug plan is wrapped into a Medicare Advantage plan, that'll be under the same premium. Like with Part B, if you're a high earner, you will have a surcharge on your prescription premium. It works a little bit differently. On the same handout, I've got a second chart that explains how those costs increase with a higher income, and it's the same appeals process and everything. So, and then finally, so you've got the premium. You may or may not have an income-based premium adjustment, and then you also have out-of-pocket costs with prescriptions. Some plans will have a deductible, and then all plans will have copays and coinsurance. And now I'm going to take you through the payment stages of prescription drugs. Whether or not you have drugs today that you need, it's good to know, because you might have them down the road. Medicare regulates these in the same way. So every carrier has the same payment stages. What varies is the retail price that they assign and the tier that they assign to the drug. But we'll take you through this now. So there are 4 payment stages, beginning with the deductible stage. Again, that's where you pay full retail price until you hit the deductible, which for plans that do have a deductible, most often it's $480, no higher in 2022. Okay. After you hit that 480, if your plan even has a deductible, you reach what's called the initial coverage stage. This is when the tiers and the copays come into play. If you've got generic, relatively inexpensive drugs, you're probably going to fall into Tier 1 and Tier 2, and prices go up from there. You stay in the initial coverage stage until the total of what you've paid in copays and what the insurance is paying to satisfy the rest of the retail costs reaches $4,430. So you pay copays up until that number, until the copays plus the insurance component reaches 4,430. I hope I said that clearly. At which point you move on to the coverage gap. You might hear this called the donut hole. It's not a total gap or hole any longer. Up until a few years ago, it was a legitimate gap. But today, as the beneficiary, you're responsible for 25% of the retail cost of the drug. Okay? Between the manufacturer and some other components, they will cover the rest of the costs. When your portion plus the manufacturer plus the insurance portion equals $7,050 in any given calendar year, you will then move beyond the coverage gap to what's called catastrophic coverage. And in this stage, you, the beneficiary, are responsible for 5%, and the insurance company will pay the rest. There is no cap on catastrophic coverage. So this is a tricky concept, and so we have a lot of conversations, and it makes a lot more sense if we're working one-on-one and I can plug in your drugs and I can show you how you'll fare each month of the year and which buckets you'll fall into. So didn't want to do a real life example up here because I thought it was just a little too in the weeds, but modeling this and showing it on the screen is extremely useful. And drugs can be the major cost driver of your healthcare needs. So it's really important to get that right. You should know that specialty drugs can be extremely expensive. And likewise with the Medicare covered expenses, there are programs out there to help with drugs. Needy Meds is a great resource. Some of you probably use GoodRx today. That's another one. It's not insurance, but if you can get your drugs cheaper outside of the insurance through a discount or a coupon, then that's worthwhile. So the point being, there are ways to help manage these costs out there. And notably, sometimes these are based on income, but not always. So it's worth exploring if you've got a major cost driver with your drugs. Okay, so we've covered Part A, Part B, covered prescription drugs, Part D. Now we're gonna do our final puzzle piece and talk about Medicare Advantage on the right side, option 2 of your map. Okay, so how does Medicare Advantage work? I know we're not doing these exactly in alphabetical order, but there's a flow to it. I didn't come up with the parts, so don't blame me. So if you decide to go with a Medicare Advantage plan, and we'll talk a little bit about why you might choose to do that. We're going to talk about how it works first, though. So what you would do is you're going to hold on to your Medicare card. You're going to keep that at home, put it somewhere safe. You don't need to carry it around, because your Part C Medicare Advantage card is what you're going to use when you go to get your medical services or your drugs. Instead of Medicare paying your claims directly, your Medicare Advantage carrier will pay your claims, and then subsidized by Medicare in the background. Your premium through your Medicare Advantage plan will cover all of your Medicare covered services. So hospital insurance, medical insurance, everything that Medicare covers. It will additionally cover your prescriptions and other benefits that Medicare does not cover, such as dental, such as vision, such as over-the-counter credits and so forth. So you're getting more coverage with your Medicare Advantage plan. With a Medicare Advantage plan, you're always guaranteed eligible. There's never health questions. As long as you sign up for an annual election period or a special election period, you're always going to be eligible. And you're always guaranteed renewable, no matter what happens with your health. And another component of Medicare Advantage plans is you can go shopping every year. Each year, we're in a competitive market in Western Pennsylvania. There's new and better options. Sometimes there are, at least. They are bringing more value to the consumer, and it's worth taking a look to determine if you're in the best plan that meets your goals, or getting the most generous benefits. So that's how Medicare Advantage plans work. You will hear about quality ratings with Medicare Advantage. So specifically Medicare stars. They actually measure Part D and Part C with stars, so same logic applies. What they're looking at with stars is categories, staying healthy, managing chronic conditions, experience, performance improvement, customer service. And within each of these categories, there are literally hundreds of data points that goes into coming up with their star rating. 5 stars being the best. Anything below 3, consider that a red flag. In Western Pennsylvania, we've got multiple 5-star plans and multiple 4+ star plans. Then, really, when you're at that level, they're pretty good options. So it's one of the things to consider when you're comparing Plan C options, Part C options. So what does Medicare Advantage cost? You will, I think there might be 30+ Medicare Advantage plans available in Allegheny County. And you'll see prices into the hundreds of dollars a month. You'll also see premiums at $0 a month. There's absolutely nothing wrong with a $0 plan. It doesn't mean that it's not a high quality plan with generous benefits. They just have a wide range. So, I honestly, the best plans and pretty much everything that I work with clients and they select, $0 to $35. There's only in rare cases does it make sense for someone to select a plan with a higher cost than about $35 per month. And like I said, a $0 plan, there is very generous, high quality $0 premium plans available in Allegheny County and all of Western Pennsylvania. So,
is this in addition to your 170/10?
yes, yep. You always have to maintain your Part B. Okay, so you've got a premium or a $0 premium with a Part C. But what's the trade-off is you have cost sharing.
What?
You have cost sharing in the form of deductibles, co-pays, and co-insurance. There's only a handful of plans that have deductibles for Medicare Advantage in Western PA, and they're not all that popular. So you really don't need to buy a plan with a deductible to get great coverage, which is nice. It's a very competitive market. The co-pays and co-insurance, I think you'll find when you're looking at things more closely are very competitive, even very competitive compared to very large group plans that you might have with your employer. So people look at that and they're often surprised with, a $250 inpatient hospital visit, no matter how long it is. So that's just one example that pops to mind as a copay for an inpatient surgery. Okay, with Part C, you're always protected by law by the maximum out-of-pocket limit. Nationally, the highest limit is $7,550. In Western PA, we have out-of-pocket limits that go all the way down to $4,500, and everywhere in between. The lower, the better. And premiums are stable, if not trending downward. It's hard to go down from 0, but it is a competitive market. So if the premiums can't go down, what does a private insurance carrier do to get more customers? They offer more generous benefits. So each year the landscape changes, and that's one of the nice things about Medicare Advantage is you can check out the latest and greatest out there and make a change every year if you so desire. Okay, so we've covered Part C. The last spot on the map that we haven't hit is Medicare Supplements, part of option 1. I know we're kind of going in circles here, but sometimes that's the way, the different components work together in different ways. It's not always linear. This is the only part on the map that doesn't have a puzzle piece with a letter. And the reason for that is Medicare supplements aren't health insurance. A Medicare supplement is, simply put, an insurance plan that covers the out-of-pocket costs associated with original Medicare. So if you choose the supplement path, your payer is original Medicare. And what the supplement will do is as long as you keep up with the premium, they'll cover those out-of-pocket costs. Remember the Part A deductible, the Part A copays, and the Part B coinsurance. That's what you're getting with the supplement is risk management around those out-of-pocket costs. So depending on the plan that you like, they're going to pay some or almost all of your Medicare cost sharing. If you're turning 65 next month, the plan with the most amount of coverage would cover all but your Part B deductible, which is $233 per year. Everything else out of pocket would be taken care of. People, they need to have creditable prescription plans. A Medicare supplement will not touch your prescription. So what you do is you pair that with a standalone Part D prescription plan. And it's not health insurance, it's not subsidized by Medicare, but it is standardized. And so every company that offers a Medicare supplement, they are structured in the same way. You'll hear about Plan A, Plan G, Plan N, Plan F. And they all have the same coverage. A Plan G is a Plan G is a Plan G. The only difference is the premium. The premium might be different, and the stability of the institution might be different. So, and also good to know that with supplements, the premiums do go up every year. It's a simple function of your age, your gender, and where you live. So with a very stable company that's insuring hundreds of thousands of people, you can expect your supplement to go up 1.5% a year up until 85 or 88 years old when it levels off. So, important to know. If you have friends or family that talk about their Plan F, Plan F is available to people who turn 65 before January 1st, 2020. So if you're turning 65 after that date, it's not going to be available to you. That's okay, because if you do a cost-benefit analysis, you actually come out on top with a Plan G if you're looking for the maximum benefits. So I can show you what that looks like on paper, one-on-one, if you'd like. Okay, now bringing it all together. Now that you know everything about Parts A, B, C, D, and Medicare supplements, how do you use that information to make an informed choice? So I'm going to try and summarize this. Why would someone go with option 1, a Medicare supplement plus a standalone prescription drug plan? So if you're selecting, for example, a Plan G or a Plan N, those are Medicare supplement types, you're going to have just about all of your out-of-pocket costs covered, complete predictability. If you have a Medicare supplement, your payer is original Medicare. And remember that slide with the map on it. That means you can see any provider in the United States. If you've got a special condition and the best specialist in the world is in Chicago and they've never heard of UPMC or Highmark, then that's okay. You can see them if they take Medicare. There's no networks. So that's a nice benefit of the Medicare supplement. If you have Part B drugs, and I don't think we've hit on that yet, but Part B drugs are not your prescriptions. It's drugs that are usually administered in a clinic, and you know they are covered by Medicare in that case. If you do require Part B drugs, almost always it's going to make sense for you to go with a supplement because they're going to cover 100% of that cost.
That'd be like a chemotherapy.
Exactly. Yep. So if you've got chemo and it's thousands of dollars a month with a Medicare Advantage plan, you'd be responsible for 20% of the cost. With a supplement, they'll pay 100%. So that's one of the only situations where it's kind of a slam dunk to go to supplement, and I would bring that up. For other reasons, you know, there's good reasons to go one direction or the other, but that's the one reason where I just know you're going to hit the max out of pocket every time. So you might as well have a supplement cover it. Really quick, sort of like, you know.
I do have a quick question.
Sure, go for it.
You're on a Medicare Part C. And let's say that situation come up, you're somewhere through the year, you come up with a cancer. Am I assuming correct that when the open enrollment comes, you can switch back to the Medicare, pick up the supplement, and then knowing you're gonna have these big costs for another year?
So probably not. You can always apply for a supplement, but if you're not in that special eligibility window, then they're going to ask you health questions, and it might go back 2 years or 3 years to say, have you been advised to do this? Have you had this condition? So probably not. However, you know, if you know you're going to have to get that procedure for several years or a year, with the Advantage plan, you are always protected by the max out of pocket. So it's not, you know, it's not ideal, but you know, for that time period, you know, at least you know what your maximum out of pocket risk is.
So what you're saying is if you are on an Advantage plan, want to switch back to a Medicare, the Medicare Part A and B can ask you those questions.
The supplement, yeah. If you wanted to switch to a supplement and you had already exhausted your special enrollment window, there would be health questions.
They're only guaranteed when you first sign up for Medicare.
Yeah.
Like within 6 months of your Part B effective date, you're guaranteed. After that, you have to answer health questions, and in that situation, they would not take it. That's not maybe they wouldn't. They wouldn't.
Now, 5 years down the road, and you've got a clean bill of health, then you could probably answer those questions.
They
And
will ask questions like within 5 years.
Yeah. Some are 2 years, some are longer. It depends on the question, depends on the carrier. Yeah.
You're always guaranteed for a Medicare Advantage. You know, if you have an enrollment period, like open annual enrollment, but you're not always guaranteed for a Medicare supplement.
Yep. That was actually my next bullet that I just brought to the screen. So you're clairvoyant. I think you just illustrated that last bullet very well. Thank you. Okay, so those are the 4 big reasons why someone would pick a supplement. Of course, the conversations get a lot more detailed and what ifs and, you know, spreadsheets to think about break-even points and everything. But to keep it simple, you know, that's the starting point. And that's what we like to do, is we like to help people hone in on things and then get into the details. Okay, so on the other side of the coin, why would you pick a Medicare Advantage plan? Well, lower premiums and reasonable copays. That's one reason. I didn't mention it, but you know, the supplement premiums, anywhere between $90 and $200, depending on your age and everything. So it's not a $0 premium. It's not even a $35 premium. You're talking.
So it would be the A and B plus the supplement plus the D.
Exactly. So your premiums are higher with a supplement, and significantly lower with a Medicare Advantage plan. The trade-off is you've got the unknown variable of you pay for the services you need through copays and coinsurance. You're always protected by the max out of pocket. So in your situation, sir, if you've got that $4,500 lowest maximum out of pocket in Western Pennsylvania plan, then that's that's what that the worst case scenario is for that year. An Advantage plan, you're going to have your Part D drugs under the same premium, so you're not going to have that extra cost. And you're going to get more than what Medicare covers. You're going to get your a benefit for glasses and hearing and dental care, fitness memberships, both gyms and streaming programs, over-the-counter credits. That's when there's a plan that comes to mind where they're going to give you $120 every quarter and a catalog, and that's where you can get your vitamins and your toothpaste. So vitamins are expensive, so use it or lose it. It's a nice little perk.
Can you get them to cover foreign travel?
I
I saw that was listed in the other ones.
So if you're talking about getting emergency care overseas, yes, both options, supplements and Advantage plans, you can get your claim paid if you're hiking the Alps and you roll your ankle. You might have to get it translated first, but you'll get it paid.
What are the downfalls then? Why wouldn't you go with the Advantage?
Well, I think the example that came up before, if you do have a year where you require a lot of services, you might hit that out-of-pocket limit. And
Somebody already has a chronic illness. They already know that they get infusion treatments every 6 weeks. They would hit that limit every year. So someone who already knows they have a chronic or they have cancer, they would not want to sign up for Medicare Advantage because they're going to be financially ahead of the Medicare supplement. But if you're pretty healthy, and a lot of people who are pretty healthy and they take care of themselves and they don't use a lot of services, they'd rather keep the money, the premium dollars in their pocket. And if they have to spend $7,550 or $4,500 because something catastrophic happens, they'll handle it. But they'd rather, they could go 5 years and never not pay those premiums and not ever spend that or longer. So it's a matter of risk tolerance is what it is. Sometimes that it's not a risk. You're actually you know what you're going to spend because you already have chronic illness. Other times, you think you're pretty healthy and you're willing to take that financial risk. And so it's a very personal kind of risk tolerance.
yeah, it's pretty easy to figure the break-even points if you're just speaking strictly financial. If you know the supplement is going to be $100 a month, and the Medicare Advantage plan is $0 a month, then how many $1,200 years does it take to hit that $4,500 or $7,500 max out of pocket? So
I have a question.
it's another way to think about it. Yes.
I'm currently on an RA drug that's quite expensive, but they actually, a lot of the companies that make these drugs have credit programs. And one of the first questions they always ask are you on Medicare or a government supplemental thing? So evidently, will give me the credit for the drug, you pay for the drug every month, as long as I'm not on Medicare. So once I'm on Medicare, they're going to charge me, and I think the drug I'm on right now is $1,400 a month. So they're going to charge me the $1,400 a month once I go on Medicare? That was going to happen?
I actually encountered this situation today with a client, and I have it on my notepad to research this, and I think it's going to be specific to that program and that drug. So
I've been on other specialty drugs for the RA, and each time, they pay anywhere from $5 a month up to the whole $1,400 a month. But that's the first question they always ask. are you on a government, insurance program such as Medicare?
What will happen with that is, if, some drugs, you can find like programs like that through that meds or through the manufacturer where they will cover. Some of them, you can get that help if you're on Medicare, and some of them you can't. But your drug, you cannot use that program if you're on Medicare. So instead, it would be covered by, you would want to pick a Part D plan that had it on your formulary,
Okay.
whatever it is. And then you'd be able to see, is it a tier 1 or a tier 2? Tier 5 is probably a tier 3, 4, or 5 drug.
Oh, yeah, it's probably.
So then you would pay whatever the plan says. So the tier 3, you might pay a $45 copay. Tier 4, you might pay a $100 copay. Tier 5, you would probably pay about 25 or 33%. But you wouldn't pay $1,400. But with a drug that's that expensive, you would go into the coverage gap, and you would go into the catastrophic stage. So that would be an example of someone who will go through those stages.
Okay.
If you were just on simvastatin or something, which many people are, that would be somebody who would just stay in that first tier, and they would never, unless they got that
Are you
$1,400
able to
drug.
look, because you mentioned that there's various programs out there, insurance carriers. Are you able to look at their formularies before you even sign up for it?
Yes.
So that you can look to see. who
Yeah,
offers better.
that's
Yeah.
more than 50% of the conversation after we talk about the timeline and everything is building a model so that exactly, we can make a prediction on what you will spend based on your current drugs, and finding there could be 30 Medicare Advantage plans, there could be another 12 standalone Part D plans. If that's your major cost driver, then we're going to spend a lot of time there finding you the plan that'll get you, your what you need for the least cost. All right, so no, that's fine. Okay, why choose a Medicare Advantage plan? You get more than Medicare pays for, or than Medicare would cover. So with Medicare Advantage plans, you can't see any provider in the country. They do work in HMO and PPO networks. However, in Western Pennsylvania, we have some options that do offer a national network. So depending on your lifestyle and your travel schedule, that is something to consider. Talk about more about that in a second. And hit it a couple of times, but with the Medicare Advantage plan, you can make a change each year based on what's new and how your needs have changed. Okay, so now we're going to talk about more detailed considerations. There's no right answer. Both option 1 and option 2 are good, but it just depends on what your personal goals are, what your financial goals are, what your healthcare needs are. So it's really, I like to say, unless I know you're going to hit the out-of-pocket max every year, it's really what makes you sleep better at night. So there's a whole slew of considerations that come into the conversations when we're working with customers, trying to narrow down those selections and help them feel good about their choice. Travel plans, health services that you require, your doctor and hospital preferences. I spend a lot of time saying, okay, who are your providers and who do you want to keep? And I want to make sure that I don't offer someone that, some plan where you can't see your dermatologist. Your prescription drugs, because they're such a big cost driver in many cases, costs, and then additional benefit perks and star ratings, all considerations. We're going to take a couple of these and expand on them. So lifestyle and travel, a lot of people these days are doing the RV thing where they might be on the road 8 months a year or something, and they don't know, when and where they're going to come up for their appointments and even have a major procedure. So, if you are someone who does that, or even spends 5-6 months a year down south or whatever, the conversation might point toward a Medicare supplement, because you can go to any provider around the country. Or if you've got some more flexibility, we might discuss and you like the Medicare Advantage option because of price or whatever, or extra perks, we might hone in on Medicare Advantage plans that do have a national network. Blue Cross Blue Shield is a national network example. There are others. We probably, or if you've got even more flexibility than that, we might talk about a PPO option, because you can visit people out of network. If your travel and your lifestyle is that way, we're probably not going to talk so much about HMOs. And then the point was raised before, but if you do like to travel abroad once every couple of years or a couple times a year even, your emergency care will be covered. Even if you have a Medicare Advantage HMO and there's no network within a couple thousand miles, if you need emergency care and that requires time in the hospital, that's all going to be covered under emergency services, whether you have a supplement or an advantage.
You buy travel insurance and the regular care just to make sure that you're covered as well. And they pay.
If you're traveling out of the country, that's usually a good idea. Because they also offer transportation home.
Right.
Like if you use
Yeah.
that. But within
I
the
didn't know if
country,
they restrict you like where you have
no,
international,
you can always
you know, that.
Yeah, I mean, this would be the emergency room care to, from a health perspective, but, travel insurance for transportation, or even if, you get sick and you're stuck in your hotel room the whole time, but you paid for this fantastic trip, travel insurance is, not a bad option to consider. That would be over and above what.
When you have an emergency and you're out of the area where you live, the Medicare Advantage plan will pay just as if you were home. So let's say and I had this happen, I broke my elbow in Florida. And so I had and it was compound fracture. So I had an ambulance, I had an emergency room, they admitted me, they replaced my elbow. And the plan paid for me as if I was here for all those services. It didn't get all sorted out the first month. It probably took them 5 months to sort it out, and I just kept watching. But I only paid what I would pay for those benefits here, because they couldn't transport me home. They had to be taken care of. Physical therapy, if I'd stayed there and gone physical therapy, they wouldn't have covered. But they will cover you, until you're stable, until you can leave the hospital.
Yep. All right, next up, doctor and hospital preferences. Like I said, I spend a lot of time making sure that people can, if they're going the Medicare Advantage route, can keep their favorite providers or all their providers usually. So if keeping your doctors and getting high quality providers is high on your want or need list, the solution is going to be, revolve really around all the options. But if the HMO is right for you otherwise, we're going to make sure that you've got access to your providers within that HMO network, or you might want to consider a different option. PPOs will offer more flexibility on who you can see, but at the same time, you're going to want to make sure that they're in network to begin with, if it's anyone who you see regularly, because that's going to be significantly more cost effective. And then, we talked a little bit about national networks before. There are multiple options in Western PA where you can get access to national networks that you'll find in most states. So you can have that in-network care almost anywhere, as long as you're domestic. If it is total flexibility that you're seeking, then the Medicare supplement is the way to go, because with Medicare as the payer, you can see anyone who takes Medicare. And then reinforcing again the health services that you expect to use. If you require those Part B drugs, more than likely you're going to hit the maximum out of pocket on the Medicare Advantage side, and it's just simply going to be more cost effective to go with a Medicare supplement. So there's always a risk, that you're balancing where we don't know what can happen. A Medicare Advantage plan will only pay 20% of those Part B drugs, where a Medicare supplement would pay 100%.
They pay 80%, you pay 20%.
Yes. But thank you, Gretchen. I flipped it backwards. You'd be responsible for 20%. The Advantage plan would pay 80%, but that 20%, can add up quickly up until you hit your max out of pocket. Okay, and then budget is high on the list for many people. This is that's an important consideration. So if you're looking to have lower fixed costs, which is in this world is all premiums, the Medicare Advantage plans are going to get you there. We talked about the $0 plan. There's nothing wrong with the $0 plan. There's some of the most generous out there in 2022. So if you want fixed costs to be low, then the Medicare Advantage plan is the best option. If you're trying to manage your variable costs, the Medicare Supplement, in particular Plan G and Plan N, will help you do that. And then if you want those additional perks that Medicare won't cover, you're going to find that with a Medicare Advantage. These are like snippets of all the conversations that I have on a regular basis while we're trying to narrow down the field. And just to reinforce this, in general, option one, the left side of your map, you're going to have, with a Medicare Supplement plus a Part D plan, you're going to have higher premiums, but you're going to have lower medical out-of-pocket costs, and you're going to have predictability. Option two, on the right side of the page, you're going to have lower premiums, but you're going to have variable copays, although you might find them very reasonable. You're going to have additional benefits, dental, vision, hearing come to mind. And depending on the services you use, that out-of-pocket will be variable. So.
One question, you said if you have an Advantage plan, it'd be hard to get onto the supplement plan because they're going to go back and look by. If you're on the Advantage, if you're on the supplement and you decide to switch to the Advantage, it's easier.
You could switch any year during the annual election period with no health questions, automatically eligible. So yeah, you can always go left to right. You can't always go right to left.
Can I ask a question?
Yeah, go for it.
You have the answer. I guess something you talk about one-on-one. It seems like you're sort of trying to show some of the positives as to why you'd be on Medicare or supplement or the C.
Mm-hmm.
But will we see any of the negatives? Let me give you an example. I was reading a book just today. It said most of these supplement Part C's do not cover hospice, different things. And then it said there are times where they may cover some, may cover some is sort of a scary way.
So the Part C Medicare Advantage plans are required. Everyone in the country has to cover everything that Medicare Part A and Part B cover, and hospice is on that list.
Where did you read that?
In the book, 2022.
Well,
page
I
61.
think it gets a little confusing.
Yeah, I know.
Because if you're on a Medicare Advantage plan, your hospice is covered, but it's actually Medicare who pays for it. I think that's what the
okay.
Oh, maybe
confusion
that's
is,
what
Yeah.
it's
but it's always covered.
Yeah.
But Medicare, the Medicare Advantage plan doesn't pay for it, Medicare does.
That's an exception where the
Yeah.
payer is Medicare, not the carrier.
So
Yeah.
it's like trying to read something
Yeah.
online. If
Yeah.
you understand it.
Yeah.
to the top.
But it's always covered.
So really, if you get a C, any medical thing, and I guess that's the hospice of that, is also covered by C if it's covered by A and B.
Yeah,
Yeah, rule of thumb, yes.
And you can't give any example where.
but they have to cover all those A and B benefits. They have to, plus they have extras.
Thank you.
Reading sometimes.
Yeah, that's you've read carefully, because that's one of the very few exceptions like that. So trying to just, summarize this, trying to make it real simple and memorable, but
But where you did get that information is the best source. That is the best place to
Yeah.
look. It's just that the trouble with that book is it tells you everything.
Yeah, I
And
know,
sometimes everything doesn't apply.
right. Or sometimes just worded in a way.
Yeah,
It's all-
yeah. But it is the best source.
So to reiterate on prescription drugs, again, this is a major cost driver for a lot of people. It's important to model those out-of-pocket costs because prescription drug plans do have out-of-pocket costs in addition to the premium. And then also consider the pharmacy networks. And that's part of what we do when we're engaging with customers, is to make sure that have predictability around that. Okay. And then we talked about Medicare Stars before, but this is also a consideration when you're comparing two options. If you remember, Medicare Stars apply to both Part D and Part C. And this is the quality rating. 5 stars, the best. Anything above 4, very good, maybe just new to the market. Anything below 3, probably a red flag. And you have other options, and there's not a lot of good reasons to select them, at least in this market. Okay, so that's coming to the end of the presentation here. This is our team again. If we'll stick around here, we'll answer questions for the group. You're welcome to stay, or if you want to talk individually, I'll stick around till the last person leaves. So I don't know if I mentioned it before, but we do not charge our customers. When we work with them, we begin at the front of the process to figure out your time frame, help you make a choice, get enrolled, answer questions, make changes to coverage thereafter, and we're compensated through the carriers. So there's no cost to work with us. Just wanted to put that out there in case.
The same way as, like, currently I'm on, I use the government insurance.
ACA, yeah.
Whatever, so you
Yeah.
work the same way.
Yeah, same model.
You're paid by.
Yeah. We're here to help simplify things and make it a frictionless process to get signed up and answer your questions.
And there's no obligation, we'll talk to you, we'll help you. There's no obligation for us to help you submit your application, but if you do, then you do.
Yeah.
There's never an obligation.
Right. So we've hit a bunch of questions along the way, which is perfectly fine, but that's the presentation. So we can open it up now and